Okay, good evening, everybody. My name is Dr. Jowsey. I'm one of the residents at Greenwich Hospital, my second year of my internal medicine training. And I'm here to talk to you all about the seasonal flu and just provide some information on what the flu is and some information on flu vaccination and hopefully dispel some of the myths and provide some useful information. So yeah, like I said, we'll today I'm just going to look at the flu, how we diagnose and treat it, and then what you need to know about how the flu vaccine works. So just a little bit about me first. I'm originally from the United Kingdom. I did my medical training in the north of England at Newcastle. That's also where I did my master's degree, and which I did in stem cell and regenerative medicine. After graduating med school in 2016, I practiced for 2 years in the United Kingdom with NHS Scotland, where I did some time working with an inpatient infectious diseases unit. I started here in the United States a year ago as a resident in internal medicine, working at Greenwich Hospital. And I've got 2 more years to go, and then hopefully moving on to a career in infectious diseases. So what is the seasonal flu? So the flu is any infection caused by an influenza virus. So usually in human beings, that's influenza A or influenza B. The seasonal flu just refers to the spike in flu cases over the winter. This is most commonly with influenza A, and usually the flu season itself starts anywhere from October time and runs through to February, March, depending on the strains passing around that season. Most cases tend to peak around January, February time, which is around now. This is just a stylized drawing of mine of a flu virus. I don't know if you can see my pointer, but this thick blue circle here is basically the shell of the virus. And inside it has 8 strands of RNA, which is its genetic material. And then these proteins on the outside, it has 2 proteins. They're referred to as H proteins and N proteins. You don't really need to know the full names. But these, the type of proteins they have is what gives the flu viruses their names. You might have heard of flu strains being called H1N1 or H5N1. That's where these come from. It's basically the genetic makeup of the outside of the flu. And that affects how the flu virus behaves and how it can infect people and how virulent the strains tend to be. So how does the flu spread? So we're because of everything that's been going on with COVID-19, everybody is very aware of more than ever of how viruses spread and how to best protect yourselves from them. And the flu is very similar to COVID-19 in the way that it spreads. It spreads by something called droplet transmission, and basically means that whenever you cough or sneeze, or whenever somebody with the flu coughs or sneezes, you expel microscopic droplets of water out from your mouth and from your nose, and the flu virus will sit in those particles, and it will spread by landing in the mouths or in the eyes of people around you, or alternatively, if it lands on a surface and somebody touches that surface within a couple of hours and then touches their face, then they can contract it that way too. And this picture here just demonstrates to you how many droplets are spread when somebody coughs or sneezes. Just to give you an idea of, although it can be invisible, you are spreading virus over a very broad surface, broad area. You're generally contagious throughout the whole course of your illness with the flu, but you can be contagious for up to 2 days before you actually start showing symptoms. So just to be aware of, if when people do develop the flu, they may have been able to spread that for up to 2 days before they even started having any symptoms. Speaking of the symptoms of the flu, I mean, most people know these because most people have experienced the flu at some point in their life. it's a very broad range of symptoms. So it can go from anywhere from not having any symptoms at all, and we refer to that as being asymptomatic, to being borderline or genuinely life-threatening. The fortunate thing is that most people who are infected with the flu will only experience very mild symptoms, and usually they'll resolve without any need for any special treatment within a week or two. The most common symptoms of the flu are listed here. So typically you'll get fevers, chills, or shaking and night sweats are very common. Coughing, sore throats, muscle aches, headaches, tiredness or fatigue, and occasionally you can also get vomiting and diarrhea, but those are less common than the others. There are a couple of things that you can use to kind of distinguish whether or not what you have is possibly the flu or just a common cold. Although there's obviously quite a lot of overlap, cold symptoms tend to be much milder and much more short-lived. This is a pictograph from the CDC, which just kind of shows you the difference between a couple of the key findings in the cold and the flu that might help you distinguish. So a couple I've just circled here, which I think are the most useful. So when you have a cold, the onset of your symptoms tends to be more gradual. So they may start more slowly and then get worse gradually and then ease off. Whereas with the flu, these symptoms tend to hit you all at once. Fever is very rare with a cold. Most people don't get feverish with a cold, but it's very common with the flu. And lastly, this one is useful as well. Headaches are very, very common with the flu, but extremely uncommon with a cold. You're only really going to get a headache with a cold if you're not taking in enough fluids. So those are a couple of things that you can use. This information is all available on the CDC website. So in general, like I said, most people will have a very mild illness, but the flu, unlike a cold, can give you very severe clinical picture and can, in certain situations, be fatal. In general, the people that we worry about having more severe infection with the flu or any complications of flu infection tend to fit into certain categories. So anybody over the age of 65 would be at increased risk of having more severe illness. People who have chronic medical problems, so that can really range any significant medical problem, but the most common ones that we worry about are any kind of lung or respiratory conditions, asthma, smoking related lung disease, that kind of thing. Anybody with a history of heart disease or kidney disease, and anybody with a history of diabetes, all at increased risk of having severe flu symptoms or complications. Also, children under 5, we worry about more, and of course, pregnant women as well. Those complications that I'm thinking of, you can get pneumonia, so that's infection and inflammation in the lungs. That can be from the virus itself, or sometimes having the flu virus can put you at risk of getting bacterial pneumonias on top. You can also get inflammation of the heart and of the brain, and very severe cases of the flu can cause kidney failure, lung failure. Sometimes the need to be intubated, to have a tube put down your throat and to have a machine breathe for you. And very rarely, but it does happen, the flu can be fatal. I think one of the key things to take away from this talk is that although it's very unlikely, anybody can get the flu and anybody can have severe symptoms and can be very unwell with it. I think COVID is showing us that just because people are younger and don't have any medical conditions does not mean that they are completely safe from having severe complications. So that's something that I think needs to be sort of made very clear. How do we treat the flu? So, most people who get the flu don't need anything else other than just to rest, to take a lot of fluid, and to just do a little bit of self-care. There are drugs that we specifically use to target the flu. So the mainstay are antiviral medications. Those are medications which specifically fight viruses. The CDC only recommends using these drugs in people who have very severe symptoms, like I just mentioned, or people who are at increased risk and have been detected to have the flu. What these drugs do is they reduce the rate that the virus is able to replicate, and it tends to shorten the length of their illness, and it also reduces the likelihood of having any of those complications that I mentioned. Medications might include Tamiflu, which a lot of people became very familiar with about 10 years ago after the swine flu outbreak. The main stopgap with these medications is they have to be given early. So unless people can see their doctor within 2 days of their starting to have symptoms, these medications don't typically have any additional effect. So they have to be given early to be useful, but they are used. The other medications which a lot of people ask about with the flu, and there's often a lot of contention with, is antibiotics. So antibiotics are different from antivirals because they fight bacteria rather than viruses. So because the flu is caused by a virus, the influenza virus, antibiotics will have no activity against the flu. And that's why healthcare professionals usually don't like to prescribe antibiotics for people who have the flu. However, a couple of those things that I mentioned earlier, complications, particularly pneumonia, you can get bacterial infections as a result of having the flu. And so sometimes healthcare providers may use antibiotics in cases of the flu if they're treating complications caused by bacteria, but routinely it's not something that we use. So as I said, what do you do if you think you have the flu? So nowadays, with COVID-19 still being very prevalent, the main thing you want to do is get tested as soon as possible. Most places are now doing a combined COVID and flu screen, so you can get tested for both as once, since there's such a significant overlap in symptoms. If you are positive for the flu, as long as you don't have any warning signs, and you're feeling otherwise okay, the main advice is just to stay at home, avoid contact with other people as you're able to minimize your chance of spreading the flu, and just to do supportive things like stay hydrated, take simple medications like Tylenol to help keep your fever down, to help with the muscle aches, and to use over-the-counter treatments for coughs and congestion as needed. The main thing to be aware of are any warning signs that you might be developing a severe case of the flu or potentially any complications. There's just a few here, the more common ones. Any sort of difficulty breathing or shortness of breath, particularly if you're having pain in your chest or in your stomach. Not passing urine is a significant sign. Any kind of severe weakness or muscle pain beyond which you think might be reasonable for a case of the flu. And if you or a relative who has the flu seems increasingly drowsy or not as responsive as normal, those are all signs that you should go and see a healthcare provider as soon as you can. Although there's a few things that's not exhaustive, the bottom line is if you're concerned, don't feel like you have to wait for one of these things. You should go and see your healthcare provider, whether that be a primary care doctor or an urgent care center, as soon as possible. Now a little bit about flu vaccines. So flu vaccines are the mainstay of fighting the flu, because as we say, prevention is always better than cure. Flu vaccines have been around now for well over 50 years. They have an excellent safety track record, and they have done wonders for reducing the burden and the complications of flu across the world. There's lots of different kinds of vaccines for different kinds of viruses, and it can get quite confusing. What I'm talking about when I say the flu vaccine here is what most people know as the flu shot, which is the injection that you have in your arm. So the flu shot contains an inactivated flu virus. So that's otherwise known as a dead virus. That's a flu virus that's been taken and had its genetic material completely destroyed using either heat, chemicals, or sometimes radiation. And without that genetic material, the virus can't do anything. It cannot replicate, it can't invade cells. But once it's in your body does recognize it as foreign, and it will generate an immune response. So your body is able to recognize that virus and produce immune cells against it without there being any risk of having an infection from it. Sometimes you might see flu vaccines referred to as being a quadrivalent vaccine. Basically, that just means that it contains 4 different strains of the flu virus. And that's the standard flu vaccine that the WHO puts out every year. One of the sticking points a lot of the time is people wonder why we have to get a flu vaccine every year. So, you know, people, when you're younger, you have your MMR vaccine and you just have that twice when you're a child and then you're set for life. Why doesn't that work with the flu? The reason is that every year the flu is very, very prone to mutating. So every season, the flu strains that are circulating can be very, very different from the year before. The reason that is because the flu contains so much genetic material. Here you can see that each flu virus has 8 strands of RNA, which is like DNA, inside itself, and those are very prone to causing mutations and making new strains of the flu. In particular, here you can see that if 2 flu viruses happen to infect the same cell, which I've demonstrated here with an arrow, the viruses that come out can end up as a mix-up of the different strains that originally went in, and you can end up with a totally new flu virus. Occasionally, this process, which is called antigenic shift, can result in new, extremely dangerous flu strains, which cause pandemics. So the pandemic of 1908, the Spanish flu, was likely a result of this process. And then again, swine flu in 2009 was probably a result of this process too. So as a result, the scientists who work at the World Health Organization spend the entire year taking all the information from all the healthcare providers across the world and working out which flu viruses are on the rise, which ones are tending to wane. And every 6 months, they make a prediction on which of the flu viruses are most likely to be circulating for the next 6 months. And then the new flu vaccine is generated every 6 months to reflect those predictions. And that's why we need a flu vaccine every year, because the vaccine that you had last year may not be effective against the strains that are circulating this year. And in general, they have an excellent track record at predicting which strains are going to be most prevalent that year. So why should you get vaccinated? Well, there's 3 main reasons. So the first reason is that it can prevent you from becoming sick with the flu. A lot of people who get the flu will just have carriage of the flu, meaning that they get the virus inside their system, but it doesn't cause any symptoms. And having the vaccine reduces your chance of developing symptoms from the flu and any kind of flu-like illness. It does also have the benefit of reducing the severity of illness in people who actually do get sick with it. There have been several studies that have shown that having a flu vaccine can reduce your risk of being admitted to the ICU with the flu by 26%, and a reduction in almost a third of dying from the flu. So very significant benefits. And the third benefit is that it reduces your risk of passing it on to other people. If you're a young, healthy individual who is very unlikely to get seriously ill from the flu, having the vaccine also minimizes your chance of passing it on to other people who are at risk, such as older adults within your family, young children, or anyone that you know who might have pre-existing health conditions. So it's not just a matter of protecting yourself, it's a matter of protecting the people around you. To that point, everybody is eligible for a flu vaccine. So as long as you're over the age of 5, you should be eligible to get the flu shot. There's only a very small number of exceptions. The main one being if you've ever had a severe or life-threatening allergic reaction to the flu, then you're not recommended to get that again. That's defined as swelling in the neck and face, trouble breathing, or anything that would get you admitted to hospital. Just having a mild reaction, if it's just a rash or some side effects, does not generally count as a severe allergic reaction. In addition, if you have an allergy to egg protein, or if you have a history of something called Guillain-Barré, then you're advised to talk to your healthcare provider before you do get the vaccine. The flu vaccine is grown in chicken eggs, so there are traces of egg protein within the vaccine. But even having a severe allergy to eggs does not necessarily mean that you cannot get the vaccine. The CDC just recommends that you speak to your healthcare provider first. Just a couple of flu vaccine myths that I wanted to dispel. So the first one is you can get the flu from the vaccine. This is absolutely and unequivocally not true. The virus that is in the flu shot is completely inactivated and is not capable of replicating, so you cannot get the flu from the vaccine. Sometimes people think that they have because the symptoms that you get from the flu vaccine are side effects. Sometimes you can get some fatigue, some muscle aching, and some pain at the site of vaccination. Can feel like the flu, but it will never be as severe. And it's just your body's way of generating immunity. Also bear in mind that the flu vaccine does not prevent infection by other respiratory viruses. And so it's quite possible that people can pick up other coughs or colds after the flu vaccine that may seem like the flu. But you definitely cannot get the flu from the vaccine. There is a different kind of vaccine called the live attenuated vaccine, which is a nasal spray, not typically widely available within the United States. Now that one does contain a live vaccine, but a live virus, but it's a virus that has been genetically altered so that it cannot cause disease. That one does have some additional restrictions on it, but it's not really widely available, and so it's not typically something that you come into contact with. In general, it's not recommended for young children or pregnant women, but your healthcare provider will talk to you about that if that's something that is available. Another myth, it's too late to get vaccinated because it's already after Thanksgiving. Again, that's not true. You can get vaccinated anytime during the flu season. It's never too late. If you think that you decide you want to get the flu vaccine and it's already into late January or February, that's fine. Still, don't hesitate. Come by. You can get your vaccine. It's no problem. I've never had the flu, so I don't need the flu shot. And never say never. Just because somebody didn't get the flu last year does not mean that they're not at risk of getting the flu this year. It's a very safe and effective way of helping minimize your chance of getting the flu and preventing it from being spread to other people. So just because it's never been a problem before does not mean it might not be a problem in the future. So always get your vaccine. So the main takeaway points from this presentation, the main one I really want to get across is that although there are specific groups who are at risk of getting ill with the flu, really anybody can become severely ill with the flu. There's no way to predict it. It's not a disease. It's something that we see so commonly, and we talk about, everybody's had the flu at some point, but it's not something to take lightly. You can get very ill from the flu, even if you have no risk factors. So take it seriously. And to that end, if you can get vaccinated, you should get vaccinated. And there's very, very, very few reasons why somebody is not eligible to be vaccinated. And lastly, is the vaccination is safe, and it's an effective way of protecting yourself and protecting people around you. Okay. So thank you very much. This video will be published on the internet, will be publicly available. If anybody has any questions, you can get in contact with us through there, and we can help answer those. So thank you for listening, and I hope everybody has a safe and happy New Year.